Good evening. Just as the kids are headed back to school and amid the worst measles outbreak in decades, President Trump today signed an executive order slashing the number of vaccines recommended for children. The goal, according to the order, is making sure Americans get, quote, the best scientifically supported medical advice, as well as protecting religious liberty and parental authority. But hold on here. What does the president really have the power to change? And what do parents need to know? In a moment, Dr. Jon LaPook with answers, but let's get right to Ed O'Keefe at the White House with details. Ed, good evening to you.
Tony, the new order doesn't set federal immunization requirements or tell parents how to vaccinate their kids. By law, only the states can do that. But it does revive a political debate important to a key element of the president's base.
Nothing bad can happen from what we're doing. Nothing bad can happen.
Today, with less than 3 months until the midterms, President Trump fulfilled one of his campaign pledges by issuing new recommendations on when and how kids get their shots.
Vaccinations for hepatitis B, COVID-19, and influenza, among others, are no longer recommended for all children.
The order also recommends states separate the traditional measles, mumps, rubella vaccine administered for more than 50 years into 3 separate shots.
Together, there could be a possibility they're quite lethal, and separately, it looks like they are not at all lethal, but just very effective.
But separate shots aren't currently available in the U.S., and public health officials warn separating the 3 vaccines can increase a child's risk of being infected with one of the diseases. Trump has long suspected the number and timing of vaccines could play a role in increased levels of autism.
Decades ago, children received only a small fraction of the vaccines required today. In those times, people were much healthier, and of course, the high rates of autism now observed did not exist.
But in tests conducted for decades across multiple countries and on more than 5 million children, there is no evidence the existing childhood vaccine schedule has posed long-term risk to children's health, nor any increased risk for autism. Among those pushing back today, Louisiana Republican Senator Bill Cassidy, a physician who urged parents to listen to their doctor rather than listening to an inaccurate executive order. The new order comes amid the worst year for measles in this country since 1991 and amid an ongoing federal court fight over whether the Department of Health and Human Services can change the vaccine schedule without consulting federal health experts. Tony?
Important background, Ed. Thank you very much. As promised, CBS News Chief Medical Correspondent Dr. Jon LaPook joins us now with more. Dr. LaPook, glad to have you here. The president says this is about the best medical advice. To that you say what?
That's great, but show us your homework. The usual thing is to have an advisory board meeting over 2 to 3 days where all the stakeholders present their research to the committee. The committee makes a recommendation to the CDC director, says thumbs up or thumbs down. This announcement today bypasses that open, transparent process.
You want to see more. So the president says nothing bad can happen from these recommendations. Your reaction?
That's not true. I'll give you a specific example. There's a widely held misconception that the only way a baby gets infected with hepatitis B is from the mother. Well, actually, a baby can get infected with hepatitis B by exposure to fluids from an infected caregiver. And it turns out that more than 800,000 Americans have chronic hepatitis B, and about half of them don't know it. And if a baby gets infected with hepatitis B, about 90% of the time it goes on to get chronic hepatitis B, which can be devastating.
So to the extent you can, for the millions of parents watching now and parents-to-be, what's your recommendation?
You have the American Academy of Pediatrics saying one thing, the President of the United States saying another thing. If there was ever a time where people should check with their health care provider, if they're lucky enough to have one, it's now.
All right, Dr. LaPook, thank you very much. Appreciate it.